Good afternoon, everyone. Welcome to our weekly COVID update. So as usual, I'll turn the floor over to Dr. Fitzgerald for her numbers for today.
Thank you, Minister. Good afternoon, everyone. Thanks for joining us today. Since the media advisory yesterday, we have one new case in our province. The individual is in the Central Health Region and between the age of 50 and 59 years and recently returned from Alberta. The total number of cases in our province is now 292. 285 people have now recovered, and in total we have tested 53,472 people. I'd like to thank everyone for their cooperation over the Halloween weekend. I hear most people were diligent with adhering to public health guidance and ensuring everyone had a safe and fun Halloween. For anyone planning to commemorate Guy Fawkes Night tomorrow, I would like to take the opportunity to remind communities and residents about the COVID-19 public health guidelines for outdoor gatherings. Organisers of Guy Fawkes Night activities are reminded of the 100 people maximum for outdoor events and must ensure public spaces can accommodate attendees by allowing at least 6 feet of physical space around individual bubbles. Residents are reminded they must stay at home if feeling unwell. And for additional recommendations and guidelines for outdoor events, please visit gov.nl.ca/COVID-19. Now that Halloween is behind us, I know that many people will begin to turn their attention to Remembrance Day ceremonies and the upcoming holidays. And while large-scale community events such as parades, fireworks, tree lighting ceremonies, and bonfires are not recommended at this time, anyone planning an outdoor event should follow the guidelines for distanced gatherings. Under Level 2, a maximum of 100 people are permitted for outdoor distance gatherings. The department has developed guidance to assist with planning such events, and that is now available on our website as well. We have also developed guidance to assist individuals in planning smaller scale activities, such as family and workplace celebrations. And while December is known as a time for families and communities to gather in celebration of the holiday season, it is important for any events and gatherings to be planned in accordance with COVID-19 guidelines. As the colder weather shifts our activities indoors, we will need to be even more vigilant about following public health guidance. Organisers should plan for situations and activities with the least amount of risk possible, and individuals should carefully consider the risk associated with any events before they attend. No individual or family faces the same set of circumstances. So regardless of the temperature, weather, or location, each of us has to think about the risks for any activity and make an informed choice. Inside or outside, people should continue to maintain 2-meter distance from others who are not a part of their bubble. A non-medical mask is an extra layer of protection, but it does not replace physical distancing. Remember the following phrase, which we use often in public health: people, space, time, and place. Interacting with more people raises the risk of spread of COVID-19. The closer you are to people, the greater the risk of spread of COVID-19. And the risk of spread increases as people spend longer amounts of time together, and indoor places are more risky than outdoors. We should all be respectful of other people's space and comfort level about in-person contact and participation in social activities. Please remember, this is one holiday season in which things will be different as we navigate life with COVID-19. We have heard from some of our seniors organizations, such as Seniors NL and the COVID-19 Seniors Working Group, as well as the Seniors Advocate, that some seniors in our province still have questions and concerns about what is safe to do during the COVID-19 pandemic. And while you should remain cautious and follow public health guidelines, especially washing your hands, wearing a mask, and ensuring physical distance between you and people outside your bubble, you should also know it's okay to leave your homes. It's okay to sit outside, go for a walk if you are able, pick up your groceries, and see your family, provided you and your friends and loved ones follow the public health measures we have come to rely on to protect us. Our province has done an exceptional job of limiting the spread of COVID-19 throughout our communities, and as a result, we have been able to implement guidelines to safely participate in social activities. We have also worked directly with the Department of Children, Seniors and Social Development on specific guidelines for seniors organizations. These guidelines will help groups organize social activities for seniors to safely participate in. Everyone, including seniors, must be careful where we get our information. For instance, the story on social media may be old, inaccurate, or not applicable to Newfoundland and Labrador. We understand these are uncertain times, but there are ways that we can all safely remain active and engaged in our communities while adhering to public health guidelines. I encourage families and friends to stay in touch with one another and reach out by phone, text, or email to check in or have a chat with the seniors in your lives. I also remind everyone, if you haven't done so, to book your appointment for a flu shot. During the pandemic, people getting vaccinated is more important than ever, and as more people are immunized, the risk for everyone is reduced. In less than 2 weeks since we started flu shot clinics, approximately 89,000 flu shots have been administered in our province, and still more people have appointments booked. We are very encouraged by this uptake, and it bodes well for reaching our target of 85% of the population vaccinated. Regional health authorities will also be administering flu shots in the school system for children in grades 4 and above. Parents will be asked to provide consent for their children if they choose to receive the immunization in school. And it is very important for parents to please send in that consent once they receive it, so that we will be able to do just that. As a recap, for those who have just joined us, we have 1 new case since yesterday's media advisory, and the total number of cases in the province is 292. The decisions and actions that each of us makes in the months ahead will be critical in maintaining a low case count. Please be kind and stay strong. Thank you.
Thank you very much, Dr. Fitzgerald. Well, today is day 242 of the public health emergency, and Dr. Fitzgerald has laid out the numbers for today and the fact we do have another new case. Again, contact tracing is underway, and public health are on top of that situation. Looking a little bit further afield, however, our concerns from the public health perspective are those of the context in which we live. So if you look across Canada, yesterday Ontario had 1,050 new cases, Quebec had over 850, Alberta recorded 570, but a 4-day total of well in excess of 2,200. These are worrying and of concern for all of us. The Atlantic bubble, however, in that same period had just 1 case yesterday, and as far as we're aware today, we have the 1 just here in Newfoundland and Labrador as an addition. Internationally, the situation varies. Canada has been taken off the Schengen area's safe fly list. The UK recorded 11,000 cases, and their National Health Service is going into an alert where they're looking at cancelling elective surgeries. They've just started a 4-week lockdown. Areas of Germany and Berlin are in a similar situation. And Belgium's healthcare system is strained to the point where they are now talking about triage protocols for those patients to get into intensive care units. So we're not out of the woods yet, but we are doing remarkably well, both as a province and as an Atlantic bubble, in the situation in which we find ourselves. This has come with a variety of emotions. At the beginning, I think there was a lot of fear and uncertainty. The uncertainty hasn't gone away, but I think the emotion has changed over time to being one of fatigue and a little bit of frustration. And some of that occasionally spills over into anger with the way people may treat workers in stores or each other on social media. And I'm not sure that whilst that may be understandable, our best treatment, our best antidote to that is what Dr. Fitzgerald referred to about safe and reliable, trustworthy information. And I think one of the advantages of social media is the rapid spread of information. But its downside is you have to pick the information that you choose to believe. And I think there are challenges there for some people who simply believe because it's on the internet and it's written down. For some reason, it must be true. I will echo Dr. Fitzgerald's comments about the flu shots. We have a limited breakdown at the moment of where these vaccinations have been given. We're still awaiting to actually have physician numbers brought into our total. So the total that Dr. Fitzgerald gave does not include them as yet, and hopefully we'll have those by the end of the weekend. We're certainly on track already to, between our bookings and the doses that have been administered, to double last year's performance, if not go further. We administered just under 150,000 flu vaccinations last year, and we already have 122,000 either booked or delivered this year. So again, well done. I think it's really important that this is one thing we can do to help ourselves. It will not protect you against COVID, but it will avoid the unfortunate situation of you getting two viruses at the same time. And it will also help our healthcare system deal with any COVID cases by removing the workload that would go with a flu spike too. So again, on that flu topic, Eastern Health are offering a service for vaccination at home for people who have mobility challenges. This is a 1-800 number. If you leave off the 1-800 number component, there is a lady in St. John's who is getting deluged with phone calls that she cannot triage because she has nothing to do with booking the flu shots. So it's 1-800. The number is on the website. It will be on our media availability and advisory notice today. Don't forget the toll-free element. The lady would really appreciate it. Thank you. This is a marathon with hurdles, and our roadmap to get through it is people, space, time, and place. We have done extremely well as a province. It is a challenge, and it's a challenge we continue to meet, and the people of this province continue to rise to. So I think with that, Kathy, I'll pause there and throw it back to you for media questions. Thank you.
Thank you, Minister. For the benefit of our speakers, we have 4 reporters registered for today's call. We will conduct the question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. Following this, I will ask each reporter if they have any further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Richard Duggan of VOCM News. Please go ahead.
Thank you. Dr. Fitzgerald, Canada's Chief Public Health Officer, has recommended that non-medical masks now be made of at least 3 layers. I was just wondering, what is your take on this new recommendation?
So that recommendation, I mean, that's been around for a while, and I think just as we start to move people indoors, I think we just wanted to revisit the mask situation. So certainly we know that a 3-layer mask with a layer, so 2 layers of material with a layer of filter in between is perhaps most effective for preventing spread.
Thank you. And over the weekend, we had a presumptive case of COVID, and public health conducted a test that determined that was, in fact, a false positive. In a case like that, where we have, the positive test and then public health test, and it's negative, how many tests are done to fully confirm that negative test? Because some people would say that if we have if we can get a false positive, we can also get false negative. So I was just wondering, to what extent, how many tests do we do to fully confirm that that is a negative result?
So I think that information actually did go out in the advisory about that, and so we tested both the original sample and a recollected sample. So there were 2 samples from the individual. Both of those samples were tested at the public health lab on 2 different what we call lab platforms, so 2 different types of machines. So we're quite confident in the false positive result.
Thank you.
Or designation, I should say, not result, designation.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
I also want to ask about the mask situation because it seems like Dr. Theresa Tam is really now pushing this 3-ply. Is that something that you are also really recommending that people use the 3-ply masks, or is that more aimed for areas like Ontario that are seeing large-scale community transmission?
So I'm certainly not suggesting that people throw out what they have and not, and not use it. But if you are going to purchase masks, I think looking for something that's 3-ply or something that has the ability to put a filter in it. Some masks have pockets that you can put filters in. I think that would be a good idea.
And there are some people that have been kind of struggling with the ever-changing advice on masks, going from initially they're not needed to recommended to required, and now being more specific about the kind of mask. What's your response to some people who get kind of frustrated at the fact that the recommendations keep changing on this?
I think we've said from the beginning that as science changes, we'll change our recommendation. Certainly that's what we've been doing. We've been responding to the latest information that we have. So it's going to change, and I appreciate people's frustration with that. I think that's felt everywhere, but this is what we have to do to stay ahead of this virus. So it's...
Sorry,
Nope,
Dr.
that's
Fitzgerald.
fine.
I think, Peter, this was a novel coronavirus. It's new by its definition. And I think one of the challenges we have had here has been around managing uncertainty. And the facts are, as Dr. Fitzgerald laid out, that we have changed our advice to mirror the level of generally accepted peer-reviewed knowledge around this virus. And as that changes, our recommendations change. And this goes back to my comments about a reliable source of trustworthy information. And I think for those people who would argue that because we've had to change our mind, that sometimes suggests to them that we don't know our mind, I think that's a false assumption, and it's unfair to the staff in public health who have done their level best to advise us of the best way to cope with COVID on this day rather than 3 days ago. And quite frankly, I wouldn't be at all surprised if in another few weeks or few months there are further new recommendations that come out, because behind the scenes with Public Health Agency of Canada, with our research background across the country and across the globe, information is coming out daily that has to be assessed and graded. And as we get that information and it provides a little bit of extra information, such as the piece around a 3-layer mask, if you're going to buy new ones, go for those. We will bring that to you. And I would encourage you to keep an eye on our COVID-19 website, on the Public Health Agency of Canada website, and maybe not so much on some of the Facebook groups or the social media feeds from Twitter, which have less accurate or less peer-reviewed and validated information. This is a changing and an uncertain situation, and will be until it's over.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Historically, we know the second wave of most pandemics to be worse than the first. And as we look across Canada, we're seeing that happen. I think Ontario in the last 48 hours had 30 deaths. Alberta since Friday had 22. What is so different about the second wave from the first wave? What aren't we doing right as a country?
I think there'll be lots of questions asked about that, and I'm not sure that anyone can answer that definitively at this point, but certainly what we are seeing with regard to the outbreaks and community spread in other jurisdictions is that these are being driven by social gatherings and by people not necessarily following the guidance that has been put in place. And so I think that's something we have to consider. I mean, we're many months into this now, and we understand that people are becoming frustrated and fatigued with all of the measures that are in place. It's making it more difficult. We've also relaxed measures, which is going to, an increasing movement and all of that. So there are lots of reasons why we're seeing more cases now. But, it is a little bit different than the first wave. We have put some things in place to protect some of our more vulnerable populations. And so I think time really will tell us really what we needed to know.
Thank you. And to note, our jurisdiction seems to be doing fairly well. Like mentioned, just 2 cases in the past 48 hours through the Atlantic region. In saying that, how likely is it that we're going to see a second wave? I know Dr. Roman was working on projections. Just wondering what our timeline is like for a second wave.
So we have to remember that our biggest risk right now for cases is introduction from people bringing it into the province. So if we're able to keep our public health measures in place with regard to isolation when you come into the province from outside the Atlantic bubble, and if people follow public health measures, continue to wear masks, wash their hands well, we do have it within our power to keep the spread of this virus as low as possible. That being said, there is always a risk that this virus could come in. Somebody may not have symptoms, somebody may develop symptoms later in a course, beyond the 14 days. So there can be reasons why this virus can spread and people can still do everything right, so to speak, right? So we do have to remember that.
Thank you.
Our next questions are from Peter Jackson of the Telegram. Please go ahead.
I do have one quick follow-up on the masks, and that is just wondering whether those disposable blue and white masks that a lot of us use now, are they considered inadequate?
No, they're acceptable. They are woven of a slightly different material, and so they are considered acceptable at this time.
Okay, thank you. I realize that you're still working on Christmas recommendations, but I'm wondering about shopping. Are there any concerns you have as shopping activity starts to ramp up?
That's a good question. Those are concerns. We still, even with the rush of Christmas, we would still recommend that public health measures be followed. So if you're in a store and there appears to be too many people in that store for your, for adequate physical distancing, then you should avoid going in there at that time. And I would hope that businesses would be careful about watching the number of people that are allowed in their stores as well at any one time. So those recommendations are still in place. We still expect people to follow them. There's also online options that people can avail of with regard to gift buying. So, there are ways to be able to do the Christmas shopping safely. And we certainly would refer anyone to our website if they were wondering about how to keep themselves safe.
Thank you.
Our next questions are from Richard Duggan of VOCM News. Please go ahead.
Thank you. Our flu season runs opposite to other parts of the world, such as Australia, and we use that data to sort of shape our preparedness for our flu season. So is there anything in particular from data that you've seen coming out of such areas that's been concerning as we move into our flu season, or even encouraging as we move into it?
Yeah, so you're right. Normally we do get information from Australia and other areas like that for flu when we're trying to look at our own season. This year, I think, certainly we haven't seen anything that's been majorly concerning coming out of that. There was an increased demand for the flu shot in Australia, which we again have seen here in Canada as well. And that helped us with our planning with regard to the flu shot. But no, on the whole, we haven't had any red flags at this point.
And ever since the beginning of the pandemic, we've heard reports about price gouging. Just curious, from a public health perspective, what have we found in terms of price gouging during the pandemic?
Well, that was a question actually addressed by Minister Stoodley yesterday in the House of Assembly. And that Service NL had infrequent reports about price gouging, but their team had determined that they didn't find any evidence that was happening. I think we have seen increases in certain prices. The issue around the cost of fuel has not yet factored into that, at least from my understanding. Supply chain issues haven't been problematic yet, although that's usually a weather-related phenomenon. So at the moment, I think there has been an increase in some goods and in some prices, but we've not got any evidence at the government level. This is outside what you would normally expect from general market conditions.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Looking at the statistics of when people are presenting for testing after travel, we're seeing 11% of people are coming forward for testing after the 14 days of isolation. How much of a concern does that present for you, considering these are people who were allowed to then end their isolation but still end up developing the disease after that?
Well, I mean, that's something we've talked about from the beginning, is that, you know, the majority of people will actually present with symptoms within that 14 days. And the 11% presenting for testing is sort of I guess it's a proxy for when symptoms develop. But some of those people would have developed symptoms before the 14 days. They just didn't present for testing until after that. But there have been some people who have presented after 14 days with symptoms and have ended up testing positive. So again, this is, you know, there's nothing, 0 cases is not a realistic expectation. We're making the decisions based on the best available evidence. And, you know, we know that the vast majority of cases will present within 14 days, but you will have the occasional case that will be outside of that time period.
And we haven't heard any updates in the last little while. I'm wondering if you have the numbers on exemptions. How many exemptions are being requested and granted and denied?
We can certainly get that number for you. I have seen one last week, but I can't for the life of me remember exactly what it was. So we'll get that for you later, and Kathy will supply that to the 4 of you.
Excellent. Thank you very much.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. With the flu clinics coming out now, and we're seeing the numbers steadily increase of those who are getting vaccinated, I'm wondering if we've had any incidents of anyone being hospitalized for influenza at this point yet.
Sorry, Kellyanne, I couldn't quite get what you were saying there.
Hospitalizations for
hospitalized.
influenza yet.
Not as far as I know at this point. Our flu report is done on a weekly basis, but as far as I know, at this point, we haven't been seeing much in the way of flu activity at all. But that's not unexpected. We often don't see it until later in the year, like in late December.
No, for sure. And I'm wondering, with your meetings with the other CMOs for the Atlantic jurisdiction and even across the country, what's the largest concern that's being brought forward?
I think at this point, it's really about trying to have people understand the importance of following public health measures and, you know, following that guidance about gatherings and decreasing the number of contacts that you have in the run of a day, and all of those public health measures, getting that message out. That's really been the most important thing I think that people have been talking about.
Thank you.
Our next questions are from Peter Jackson of The Telegram. Please go ahead.
Hi, Minister Haggie. The department was allotted $100 million for pandemic-related costs. The budget. I'm wondering how much of that has been spent. Where it's mostly going at the moment.
Certainly, I can get you a breakdown of those figures, and we'll share that with you. I couldn't give you a breakdown off the top of my head. I know there was a tranche that was for PPE, and my recollection is that's around 40 million, and there was a similar tranche for actual kind of COVID testing and screening, testing and tracing. But I will find you a breakdown and get that for you, well, for each of you, as soon as we can get staff to do that. Won't be long.
Oh, okay, thank you. Also, I'm assuming that the same accessibility would be in place for the COVID vaccine as for the flu. Are there any other measures being planned to facilitate the uptake?
I didn't quite catch some of that, Peter. Your voice chopped up a little bit there.
The accessibility for the flu vaccine, I assume that you would arrange for the same accessibility for the COVID vaccine. Are there any other measures that you're planning to facilitate the uptake?
Well, from our point of view, one of the things we said was that this, in a sense, was a dry run for when the COVID vaccine would be available, and particularly our online self-scheduling module. I'm delighted, and I have to admit, rather surprised at how well it has functioned. I was a bit skeptical at the beginning, but that has been a real stellar piece of scheduling. In terms of our allocation, Canada as a country would appear on the information I've got to have bought sufficient supplies of vaccine should each of those sources prove out. I think the national mechanism has done that on the basis that we don't actually have a proven product yet, and if one of them doesn't, then there is redundancy there to ensure supply. This will obviously come out in phases. It won't be available for everybody right from the get-go, and we will have to start with a program similar to that we used for H1N1, which started with vulnerable people and people who were at risk by virtue of their jobs, the healthcare providers, and so on and so forth. And then there is a kind of phased approach to make sure, as the supply then follows and comes behind, that the general population would be accessible to them.
Richard Duggan, do you have any further questions?
As we move into the holiday season, I know that for myself and others, that would mean packing up and heading for a couple of days out around the Bay. I was just wondering, are you concerned about a possible influx of people going to these smaller communities around Newfoundland and Labrador that would otherwise be more isolated geographically?
I mean, I think at this point, if we're talking about people from Newfoundland and Labrador traveling elsewhere in Newfoundland and Labrador, we've certainly had, good success with that over the summer. And so as long as people are following public health advice, as long as our epidemiology stays the way it is, then that should be a safe thing to do.
Thank you.
Peter Cowan, do you have any further questions?
I'm good, thanks.
Kellyanne Roberts.
I just have a question in regards to Christmas. I know the Christmas squad is working on it, and there'll be more information coming soon. Just wondering if there will be something separate for rotational workers, or if it'll all be, I guess, everybody in one announcement.
So I think rotational workers have their, we've recommended the isolation and testing combination that we have up to this point. So Christmas is going to be, the information is going to be a little bit more general, I think.
The other piece around rotational workers is one group that has kind of not been forgotten by us, but is not something over which we have any control, are international rotational workers. They fall clearly under federal jurisdiction and are subject to orders issued under the Quarantine Act. From the point of view of the health ministers, we have referenced these in our discussions, but that jurisdiction lies solely with the federal authorities.
Thank you.
Peter Jackson, do you have any further questions?
No, I'm good. Thanks very much.
Thank you very much for tuning in, everyone, and we hope you have a great evening. Bye-bye.